بيكم تسمعوا في اكسبريس اف ام وتتفرجوا فينا مباشرة من وان هيلث كونفرنس في الأكاديمية الدبلوماسية في تونس، حوارات مع مختلف المشاركين الباحثين والنخبة العلمية اللي موجودة من العالم الكل اليوم في تونس. وسعيدة جدا باستضافة ضيفتي الثانية دكتور واندي أليمي. دكتور واندي أليمي, One Health Lead, Africa CDC. So thank you so much for joining us today as the One Health Lead at Africa for Africa CDC. So you are at the forefront, maybe, of one of the crucial cross-cutting public health mission. So to begin, could you help us understand what does the One Health approach mean? Why a conference like this one is very important for the health, not only in Africa, but in the world in general?
It's such a pleasure to join you this morning. I'm from the Africa Centers for Disease Control.
The mic, please. Thank you. Make it closer to you. Yeah, thank you.
Thank you so much for having me this morning. And I'm from the Africa Centers for Disease Control and Prevention. Africa CDC, as you may know, is the African Union's foremost public health agency, really helping countries to ensure that we have a safer, healthier Africa. But most importantly, I think the history of Africa CDC is quite important in this conversation, because it was as a result of the heads of state recognizing the need for the continent to be able to set and own its own sort of continental health agenda, as well as security. One Health is such an important topic in this current age and time. It's simply a way where we can start to work together, thinking about it in terms of a collaborative, transdisciplinary or multidisciplinary approach that cuts across sectors, be it health, agriculture, environment. Really, it's a way of us thinking together. How can we work together to ensure that we have optimal health outcomes, not just for human beings, but also the environment we live in, the animals, the plants, our shared ecosystem. So I think having this conference is such a timely conference, because it brings in the relevant stakeholders as we start to shape in some of these conversations around One Health. But when you say One Health is a way of life or a way of working together, what exactly do we want to achieve? I think it's very important to talk about a bit of some of the challenges many African countries face as a result of the interconnectedness of humans, animals, and the environment. I'll give an example. You've heard about quite a number of diseases, things like we have currently the ongoing Mpox across many countries. You would know that Mpox, the virus, originates from animals. I think one thing we need to know is that as human beings, we're in a shared ecosystem. Our interactions with agriculture, with the wildlife, potentially puts a lot of risk on things like a spread of diseases. Also, another thing that is quite important in this conversation is you would notice that the temperatures are gradually increasing. The weather, as we know, is no longer what we know. We can no longer predict. And in a very simplistic way, it means that climate change impacts are closer and are more reality than we know. But climate change does not just sit alone. How does that impact the health system? The more we are seeing some of these floods, we are seeing disease outbreaks such as cholera. Sometimes you see things like mosquitoes in places that they were not before. Many countries that did a good job in eliminating malaria are starting to report new cases of malaria. But beyond that is also the critical trend or challenge of AMR. As you know, AMR is a global threat, but Africa bears the highest burden of AMR-related deaths across the world. And AMR is not just in the human sector. You think about things like your poultry farms, your livestock, where antibiotics are being used as growth promoters. You think about how antibiotics are dispensed or disposed. For example, some people just throw it in the rivers, flush it down the drain, leaving antibiotics in our ecosystem and significantly changing a lot. So these complex threats require us to take a step back. How can we change the way we are working? Means that your responsibility in the Ministry of Health is not just for humans only. Everything is interconnected. The policies, the interventions we put in the agriculture sector could potentially help us as humans to have better health outcomes. As we are more responsible in terms of the impact we know on our ecosystem, we can protect the planet Earth. So really all of this helps us think in in an unusual way. You know, the way we have always thought about health or addressing problems is it's just me, it's just my ministry. But this offers us a new way of thinking. How can the ministries of health, ministries of agriculture, ministries of environment,
of education, for the awareness,
think about finance? How can we ensure that some of the benefit of One Health, for example, we can amplify to the ministries of finance? But I think there's something that we mustn't forget. A lot of times we talk about One Health in a ministry approach. It must involve the communities.
Exactly.
And this such a conversation that I'm having with you is important, because this is how we can bring some of the fantastic conversations we're having in this conference to the general public. We can let them know One Health is not just a ministerial responsibility. Back home, where you're sitting, where you're listening to this, what are the One Health sort of responsibilities and interventions that you can start to contribute to ensure that we have a safer, healthier Tunisia, but also like in the region, in the MENA region, as well as the African continent and globally. So I think this conference has been very timely. I really, really want to applaud the leadership, the political commitment. I think it's really showing the leadership at an exemplary way to say our ministers are keen to ensure that we can work together. We as technocrats need to work very closely together, but also take these conversations to the grassroots levels. How do we involve our youth groups? How do we ensure that we have more other stakeholders? For example, the media has been a fantastic platform, and I'm just pleased to be able to speak to you, because the media has been a fantastic platform in terms of how do we simplify this message? What is One Health? How does the media help us amplify it in such a way that the younger population, the Gen Z of our time, can understand what is One Health and what is my value in these conversations on One Health?
Exactly, 100%. Now you're bringing me to my next question. When the environment is sick, the animal or the living is sick, the human is also sick. So I must be a little bit anxious about the future of this planet. You have been talking about the awareness, the importance of communication, simplifying concept. Now, is the CDC working maybe on different communication for the Gen Z? Maybe are you using social media to bring to the youth new information, to make them aware or more aware about the risk that are tackling our environment and our health, not only physical health but also mental health?
So I think from our side at Africa CDC, we really recognize the value the media really brings into this conversation. And I'm quite pleased that earlier this year, the communications colleagues had a training specifically for media.
Great.
And I was pleased that my team was able to facilitate some technical conversations and teachings for media. For us, we know that One Health is it can be very technical and confusing. But we recognize the value that the media helps in breaking and simplifying this. And from our experience, like last year as well, we had a bit of engagement with the media, ensuring that we are able to simplify some of these conversations, like climate change. How do we make climate change and health a very simple?
It's very complex.
Exactly
for youth.
For youth, for anybody generally. So we really have really put in some interventions in engaging with the media. My team back in Addis are very passionate about youth. So they have several youth alliances, youth programs where they bring in young people, really socialize this topic. I think the youngest population that I've been able to engage with, I think students in primary and secondary school. So 2 years ago, we had a photo contest whereby we said, we described One Health AMR to them. And we said, from your environment, can you take some pictures? Can you tell a story? Such a fantastic submission from different parts of the continent. You could see the young people understand One Health in a slightly different way. It was also a learning experience for us, because we're starting to see how younger people can contribute significantly, and younger people can hold us accountable in terms of some of these interventions that we are putting in place.
Yeah, this is great, because you are telling something that maybe can ensure that the future will be better and the next generation will be maybe more aware than us, hopefully. It was great pleasure meeting you, Dr. Alimi, and I hope you enjoyed the conference and your stay in Tunisia. This is your third time and not the last time in Tunisia. Thank you very much.
Thank you so much.
Thank you, Dr. Alimi. نحن مازلنا موصلين معكم مباشرة من الأكاديمية الدبلوماسية في تونس في متابعة مباشرة للون هيلث كونفرنس. فاصل صغير ونرجع لكم.